October is Breast Cancer Awareness Month, a time when we support both patients and survivors battling the disease and talk about the importance of early detection. Our Liz Lewin joins us tonight with a message from one local survivor. And Liz, she says it's all about being proactive.
It is, Mary Alice. You're absolutely correct. Well, we've heard it before, right, Mary Alice? The best medicine is preventative medicine, which starts with being proactive. One woman, as you mentioned, Tony Vasquez, was brave enough to share her story with me in hopes that it inspires more people to do the same.
I did not hear a word that she said after she told me that my biopsy had come back positive.
Tony Vasquez is a wife, a mother, a businesswoman, and a breast cancer survivor. Like many women, Vasquez started getting early screenings before she hit 50 as a preventative measure, which, looking back, may have saved her life, especially considering some first cousins were diagnosed with breast cancer before they even turned 40.
That's very young to get diagnosed. So I started at 40 and I started going for my regular screenings.
Back in 2016, Vasquez was diagnosed with high-grade ductal carcinoma in situ, a non-invasive early type of breast cancer that starts inside the milk ducts. If left undetected and untreated, it could become invasive over time.
They wanted to do some additional films, and they did the additional films. The doctor then came and spoke with me and said that she had seen something that looked suspicious for what they call DCIS. I remember just thinking, oh my gosh, what have I done? What have I done to my children? What have I done to my daughters?
Doctors recommended Vasquez undergo a lumpectomy and radiation, which she says was mentally, emotionally, and physically exhausting.
I had to undergo 36 sessions of radiation. And, you know, they were consecutive. There are 36 days of consecutive radiation.
Dr. Marie Quinn is chief of breast imaging at Roswell Park and suggests having some sort of risk assessment.
The earliest we would start with a mammogram in women who are at increased risk is at age 30. So knowing your risk is really important.
According to Roswell Park, Black women are at a much higher risk when it comes to breast cancer, starting at a younger age.
They're more likely to be diagnosed with more aggressive forms of breast cancer, including triple-negative breast cancer and breast cancer at a later stage. And they're also more likely to die of breast cancer.
Which is why early detection is key. Vasquez says she still gets a mammogram every 6 months until she hits her 5-year mark, which is coming up soon.
I just embrace myself more because I'm thinking I'm the only me that I have.
It's a great story. And hey, this again is worth repeating. So grab a pen and a pad if you have one. Roswell Park suggests annual screenings for women 40 and up. If you're younger than 40 and have a history of breast cancer in your family, get a screening. And if you have any major risk factors like a gene mutation, get a screening as well. And I want to mention, Mary Alice, you encouraged me tonight. I do have a history of breast cancer in my family. So I emailed Roswell and I'm scheduling my first screening in 2 weeks. Reporting in the studio, Liz Lewin, Channel 2 News.